Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the MedSurg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the MedSurg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. So take a breath, open your notes, and let's make the NCLEX feel a little bit less overwhelming. Let's do it together. Let's get started. Welcome to Chapter 22, Coordinating Care for Patients with HIV. We talk about NCLEX and how NCLEX can get questions from this chapter. So, as we know, the HIV targets CD4+, so is the T cells. If you still little bit unclear, you can go to outline and terminology to kind of review if you need. So the NCLEX is broken, as we know, in 15 specific domains, and it's not about knowing your content. It's about how knowing how to apply in different situations. So those domains include the traditional A categories like management of care, basic care, plus the 6 clinical judgment right here, which is a huge focus on the new exam. So this is somebody's from Facebook group that I joined, NCLEX 2025. Somebody says that needs some recommendation. It's second time. I've been seeing that there are other candidates that had a similar problem because of one or two, three categories could not pass here, could not pass those levels. And as we know, this is the latest. It's a booklet that I have also in this description, but also you can go on their website and you can just download it. It's a little bit bigger, this not PowerPoint, PDF, but they shows examples and explain more how this exam it's all about, and gives you examples, kind of a study guide about those to make this pie right here. So some questions it's in this category, but also they kind of back and forth with in this one. So I decided that to organize my notes through these 15 domains, and I will learn how to place them into the correct context for the exam. So I'm thinking that, okay, if NCLEX is just on this chapter, I need to making this pie. So, but you see, like here it says like each slice has a little percentile. So think about if you want to pass with 100 questions, imagine you need to do like, you will do like 15 to 21 questions just because of this, and then either 6 to 12. So imagine, and I think it's better to think to have like case studies or just select all of the apply. Bone tie, they have alcohol, blank like a blank, and then you go in the box and you select. Also they have those tables that you have to just click. I hope you have stimulations to to kind of see your level, because each stimulations they will show you question from this area, from this pie. And those big companies that they make proctors like Kaplan, ATI, UWorld, etc. Even Lecturo now, it's very good. Lecturo gives like a free stimulation, very good in April. So I had to play with it. So it was really fun to see where where is my level. So um, so think about how you make connection to clinical judgment. So in case some candidates, they don't know how this plays with this pie. So think about recognizing a cue. It's what clinical manifestation, so clinical manifestation of HIV are observing in the patient. Analyzing cue. Do the clinical manifestations correlates to underlying pathophysiology of HIV? Also think about prioritizing hypotheses. What could happen if this patient HIV is not effectively managed? Generate solution. What treatments are included to manage this patient's HIV? So what is the rationale? And then also think about taking the actions. What are the priority interventions for the patient with HIV? And evaluating outcome, what findings demonstrate that the treatment plan is effective? So you just answer these questions and see if you can get like one, not one. Think about that those questions can be select or apply. Just think about around 5. 3 should be the minimum, but around 5 examples for the above question I just said. So think about the treatments, priority interventions, what the findings demonstrate that the treatment plan is effective. So think about clinical manifestation and how clinical manifestation correlates with pathophysiology. So this is the with HIV. I want to show you something else more. So what I found a few days ago on very interesting article, I want to take you to that article and tell you more about it. In the outline, I was talking a little bit about of, on outline at the end of the video. I was talking about this article. So you see, it's September 29, 25. So was this is a university research, and they have a very interesting article. I don't want to talk much about this. Just if you're curious, you can Google it and you can read, and you'll see something probably new that you might not know. I hope you know, I hope you found it, but for me it was something new, and I like to share what I just found out. And this is September 29, and today it's October the 2nd, 25, when recording this. So it's I'm very excited that I just found something very, very, very soon. So we still are in coordinating care with the patients. So just a reminder where we are, and this is the pies. Our candidate performance report, and these are the definitions. Just copy and paste from over there. And I just decided to make one example from my chapter for this one, and I hope it's better understanding what. So we'll think that this chapter is NCLEX, and that's it. I'm gonna need to pass my NCLEX, but I get HIV from this chapter. So imagine that. So now we go one or two questions per each domain, and just practicing. So you see here, management of care provides and directs nursing care. The care delivery settings to protect the client in healthcare personnel. So example, ensure that the client newly diagnosed with HIV receive appropriate referral to case management and social services. So you see, management of care can be the referrals, and especially for social services, because also they have mental health issues. So keep that in mind. Safety and infection control. Implement contact precaution. Wear gloves gown when providing care to a patient with HIV and active tuberculosis. But with active tuberculosis, you need mask N95, and also it's negative pressure. So health promotion and maintenance, here is the definition. Example, educate sexually active clients with PrEP and the importance of regular HIV screening. Then psychosocial, provide emotional support and community counseling referral for a newly diagnosed HIV positive adolescent. Basic care, like many candidates, has this problem here. Assist an HIV client with fatigue to bath and maintain personal hygiene. Then pharmacological, administer anti-retroviral medication and educate on medication adherence to prevent viral resistance. So here in outline I was talking a lot on medication, complication and prevention there, a lot about this. So, and also I mentioned few side effects. Reduction of risk potential, monitor for signs of opportunistic infection like PCP in a patient with CD4 plus, count under 200. So that gets to AIDS. Psychosocial adaptation, manage respiratory distress in a patient with HIV-related pneumocystis pneumonia. Clinical judgment, recognizing declining CD4 plus count and prioritize evaluating patient for potential new infection. Recognizing a cue, identify a sudden drop in CD4 plus level and the presence of fever as cues for opportunistic infection. So think here some patient can have high level, but also they can have a very low grade fever. So now we are in clinical judgment. skip my light here. So recognizing declining CD4 counts and prioritizing evaluating patient for potential new infection, recognizing a cue, identify a sudden drop in CD4 levels and presence of fever as a cue for opportunistic infection. So they are very like the low CD4 level a patient gets, a person, or then the opportunistic infection, it's really opportunistic, invades, and for even a little breeze can get sick. They can get pneumonia just from a breeze going to the ocean. So also be able to recognizing the cues, but also teaching about nutrition. They lose weight, and also nutrition that they cannot eat raw fruits and vegetables because of the opportunistic infection. Think about HIV patient with and AIDS. They're so sensible to get so quick any sickness extra beside this. So keep that in mind. Analyzing a cue, correct patient's weight loss, oral thrush, cough with potential HIV progression, or a new OI. OI, it's the opportunistic infections. Prioritize hypothesis. So prioritize potential sepsis in a HIV client with elevated temperature and hypotension. Generate solution. Initiate prophylactic antibiotic and oxygen therapy for suspected PCP in HIV patient. Take action. Immediately isolate a patient with HIV and signs of TB. Initiate airborne precaution. Evaluate outcome. So reassess the CD4 plus count and viral load after initiation are to evaluate treatment efficacy. So let's go on the next. Okay, we have more management of care. You see, they talk about isolation. I think every chapter that has about infection, they talk about isolation. What type of isolation? What type of infection does the person has? So be careful that the HIV, they can potentially get TB. And decide when isolation is needed. Determine RN versus the CNA task. Medication teaching stays with RN. You see, so but I think this it's obvious question. Allowing the CNA to explain HIV medication or isolation reasons. So here I think will be a question when the RN supervise or newly RN or supervise a CNA when to intervene. Maybe the RN hears that the CNA explained to the family that why their loved one they are in isolation, so they should not. So then the RN needs to intervene then, because it's not to a scope of practice. Safety and infection control, standard versus contact precaution. You see, needle stick prevention, then apply proper precaution per pathogen, evaluate staff compliance, apply PEP, you see steps correctly. So you need to make sure the steps failing to initiate PEP within hours of exposure, forgetting soap water for C. diff, and then transmission education about those, testing and art here. You see, explain prevention tools like condoms, PrEP, medication, skipping the STI co-screening. Okay. So just take a short screen and you can read when you have time. You see underestimating weight loss or fatigue. So keep in mind that. We go next. Here I put little bit different and more. Again, we are on those 15 domains. Let's see on basic care. So provide small nutrient-dense meals for anorexia, nausea, manage fatigue with rest activity balance. Ignoring weight loss missed red flags for progression or treatment failure. Then weight loss with 10%, red flag, nutrition supplements, high calorie, high protein, right? Then you see monitor prophylaxis meds, missing doses, giving a contraindicated. You see again live vaccine. I was talking in outline about the vaccines that they can take and not to take. Reduction risk. You see monitor for early opportunistic infection signs, fever, cough, skin lesion, neuro changes. You see no raw foods, no cat litter. And here it talks about the labs. Report the temperature, weight loss, new neurovisual symptoms, but also we know the fungal infection. Evaluate ABC Maslow. I think with all patients, all causes, but this is more priority. And then teach back method for art. Teach back, you know, like they had to tell you. So miss one dose per month, it's this percentage. So assuming patient is adherent without checking the refill history lab. So make sure that refill history and refill the meds and the labs. Okay, so now we go next. Here is my hypothetical case study. A male, 45, progressive fatigue, weight loss, oral thrush, and chronic cough over the past few weeks. Medical history, diagnosed with HIV 2 years ago. History on unprotected sexual encounters. So current medication and PCP prophylaxis. Vital signs, so it's kind of borderline. Respiration and lab results, CD4 plus count, viral load, recent X-ray, pneumocytitis, pneumonia, and then present with signs of opportunistic infections, art, And now we go into the questions. So clinical judgment, pharmacological and parental therapies, psychosocial integrity. So you see 1, 2, 3, 4, 4 in just one question. So the nurse is reviewing intervention for a client diagnosed with HIV and a D4 plus count of 180 cells. Which of the following interventions should the nurse include in the care plan? Initiate airborne precaution, administer the Bactrim as ordered, educate the patient to avoid raw seafood and undercooked milk, discontinue ART due to immunosuppression, monitor for signs of oral candidiasis, assess for depression or psychosocial stressors. So on the next page, actually I have the rationale of this um, select all and apply because you see it's big, and 1, 2, 3, 4 categories. So I said this in outline. So we just talked earlier about raw seafood and raw vegetables. Monitor for oral candidiasis. We talked about the fungal. Depression and psychosocial stressor, the social worker for mental health. So here is the rationale. Bactrim is used for clients. The raw uncooked food increases infection risk. Oral thrush is common in immunosuppressed clients. Psychosocial stressor and stigma should be addressed. On PCP is not an airborne, standard precaution apply. ART should be continued unless contraindicated. So here is not airborne because it doesn't have the TB. So we are in psychosocial adaptation now. Which clinical finding best supports the diagnosis of progression to AIDS? The CD4 plus count, the viral load less than 20 copies, development of PCP, complaints of mild fatigue only. Correct answer is development of PCP because it's an AIDS defining opportunistic infection. We're in question 3, domain health promotion and maintenance. The nurse is evaluating the understanding of ART adherence. Which statement by the patient indicates a need for future further teaching? I take my medication even I feel fine. I know missing doses can lead to resistance. I can't stop taking meds when my CD4 count improves. I keep my pills in my daily organizer to help me remember. So C is the correct answer. R must be taken consistently for life to suppress viral replication and prevent resistance. So need for further teaching. I can't stop taking meds when my CD4 count improves. So the nurse needs to intervene ART must be taken constantly for life suppress viral replication to prevent resistance. Now we are in question 4, domain, clinical judgment, and psychosocial adaptation. What is the priority nursing action when our client reports shortness of breath and non-productive cough with increasing fatigue? Encourage fluid intake, prepare for sputum culture, administer order corticosteroids, assess oxygen saturation and respiratory rate. So correct answer is assess oxygen saturation and respiratory rate. So we have to ABC and mass flow we said earlier. Respiratory assessment is the priority to detect hypoxia from PCP. Now we are in domain 5. We're getting close. Domain pharmacological and parental therapies. A newly licensed nurse asks why the client is receiving both ART and antibiotics. What is the best response by the preceptor? For the nurse, the RN. ART cures IV while antibiotic manage side effects. Antibiotics prevent and treat opportunistic infections while ART suppress HIV replication. Both are used to increase CD4 count. Antibiotics enhance the function of ART medication. B. Antibiotics prevent to treat opportunistic infection while ART suppress HIV replication. So ART targets the HIV and antibiotic are for opportunistic infection like that PCP. We are in domain psychosocial integrity. Which of the following demonstrates the nurse's understanding of psychosocial integrity in client's plan of care? Referring him to hospice care immediately. Encourage client to maintain complete isolation, discussing coping strategies and supporting creative outlets. Advising him to stop working immediately. C. Supporting emotional well-being and creative expression is key. So discussing coping strategies and supporting creative outlets. Question 7. Management of care. Which task should the nurse delegate to CNA when caring for a client with HIV and oral thrush? Teach the patient to use chlorhexidine rinse, report changes in the patient appetite, apply antifungal medication to oral lesions, assess the patient with oral care using a soft toothbrush. So the nurse delegates the caregiver. What is in the scope for the client? D. Assess the client with oral care using a soft toothbrush. The CNA can assist with hygiene but not teaching, assessment, or medication administration. Safety and infection control. Which action demonstrates appropriate infection control by the nurse? Using airborne precaution for PCP, placing the patient in negative pressure isolation, performing hand hygiene before and after glove use, reusing a disposable thermometer for the same patient. So it's safety and infection control. So hand hygiene before and after gloves use is fundamental infection control practice. Which of the following lab requires immediate intervention for a client with HIV? So all the labs, which one do you think? Platelet count increases the bleeding risk and requires close monitoring. See, less than 100. We are almost to the end. This is the last question from this chapter. So basic care and comfort. This is very important for some candidates. Which comfort measure should the nurse provide to help our client manage the oral candidiasis, so the fungal? Offer carbonated beverages, encourage warm saline rinses, provide spicy high-calorie meals, withhold oral fluids for 12 hours. Correct answer is warm saline rinses can smooth oral tissue and help clear debris without irritation. Encourage warm saline, you see. So I think this question is so obvious. Why do I have to give this? Why do I give this? And it's encouraged to, I can tell the patient to do not drink unless it's contraindicated. But why? Right? So encourage warm. And this is the key word here, encourage. We always encourage. We don't demand. If the client wants to do or not do, we just teach and encourage. We don't force anybody. So I hope this little video give you some extra insights, and I'm checking out, and it's time for me to tell you my last thanks and goodbyes.
Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing student who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.